Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Classification in the psychiatry. So first is the ICD-11. So ICD-11 stands for the International Statistical Classification of Disease. So this is the 11th revision, and this revision is brought by the WHO. Next, moving on to the DSM-5 criteria. Here is a diagnosis. So you do a diagnosis as well as a statistical manual of the mental disorders. So statistical manual of the mental disorders. This will be the 5th edition by the American Psychiatric Association. So American Psychiatric Association. So this is only meant for the mental disorders. So this came in the year 2013. Then comes the DSM-4 TR. So here they had a multi-axial system. So there was a multi-axial system here. It is described by various psychotic disorders in various axes. So there is axis 1, 2, 3 and 4. So what is axis 1? Axis 1 means there is a psychiatric disorder. They are put under the axis. So example being the schizophrenia. Next is nothing but the axis 2. Axis 2 means there is a personality disorders and also the mental retardation. So you have first one is the psychiatric disorders are put into under the axis. Second one, personality disorders as well as mental retardation. Then comes the axis 3. Axis 3 means there is a general medical conditions. So there is general medical conditions. So this includes the DM, that is diabetes mellitus. So 3 is general medical conditions, A is psychiatric disorders, 2 will be the personality disorders and the mental retardation. Then we move on to the axis 4. Axis 4 means there is a psychosocial or the environmental. So psychosocial or environmental problems. So here there can be divorce, which comes under the psychosocial problems. So psychosocial problems. So there is divorce which can comes under the psychosocial problem. This is the 4th one. Then when we move on to the axis 5. So here under axis 5 it is a global assessment. So global assessment of the functioning of the patient. So the functioning of patient is around 40. Functioning of patient is around 40. So it is described from 0 to 100. So described from 0 to 100, where 0 is the minimum functioning, whereas 100 it is nothing but the highest functioning. To learn and grow daily like this, please do subscribe.